Good afternoon, everyone, and thank you for joining us today at the Palliative Care Nurses of Australia webinar. Today we have the privilege of having Peter Hudson join with us, and he's going to present to us about the CarerHelp website. Peter is the director of the Centre for Palliative Care, which is an academic unit that's based at St Vincent's Hospital and a collaborative centre of the University of Melbourne, Australia. Peter is an honorary professor at the University of Melbourne and also an honorary professor at Verge University in Belgium, and apologies if I have pronounced that incorrectly. Peter is a registered nurse with approximately 30 years experience in palliative care, incorporating practice, education and also research. He is a former Vice President of Palliative Care Australia and a past member of the Board of Directors of the International Association for Hospice and Palliative Care. He is a Board Director for the newly formed International Neuro-Palliative Care Society, European Association for Palliative Care, International Palliative Care Family Caregiver Research Collaboration. He is a co-lead of the multi-country European Union funded palliative care clinical trial, a past recipient of the Premier's Award for Translating Evidence into Practice, and a USA Fulbright Scholar. Please join with me in welcoming Peter, and again, I'd like to thank him for his presentation today.
Thanks very much, Julianne, and thanks very much to PCNA for the invitation to present some information around CarerHelp. Really delighted to have this opportunity, and I was very pleased just before we commenced, had a chance to have a bit of a chat with Vicky Ann and Julianne. It was great to hear about the number of nurses involved in palliative care. Nurses Australia, it's terrific to see so much interest, and so pleased to have this opportunity. And thanks for that introduction. So, yeah, so my background historically is in home-based palliative care nursing in the most part, and that was predominantly in the UK, but also I was involved in a large palliative care service, community service here in Melbourne, and then some episodic work with the consultancy service at St Vincent's Hospital in Melbourne. But over the last probably 15 years or so, I've been what I would consider a bit of a quasi-nurse. I kind of haven't had a patient load as such, and occasionally dabble in the consult service at St Vincent's with but more as a I suppose in a shepherded capacity. So going around with the team just to get a sense of what's still happening at the coalface. But and that's very important. But I don't get enough opportunities to do that. But my research is very much, I suppose, very practically related, and most of it's applied research, and the education and training we're involved with at our centre, again, is very much focused on really what's happening at the bedside in terms of palliative care in the most part. So I still feel very connected, but do miss the day-to-day clinical realm, I must admit. And my interest in family carers really stems from my clinical practice. Primarily when I started in this area, I was quite perplexed why some family members seem to cope with the experience of looking after somebody with advanced disease reasonably well, and others seem to kind of fall apart, and there didn't seem to be much of a rhyme or reason for that. And moreover, there didn't seem to be many evidence-based strategies at the time to be able to help family members. We do our best as nurses and allied healthcare professionals, etc., but there really didn't seem to be a lot of data underpinning some of our practices. So I'm pleased to say the landscape's changed quite significantly in terms of the amount of evidence that's around to support family members, but there's still quite a few gaps. So what I'd like to do, and from that, I suppose, my interest has been maintained through a number of initiatives in terms of research and also policy influence as well around family carer research. I do other types of research, but this is one of the main areas of focus. So what I'd like to do today is really just provide you with an overview of a new resource which we've called CarerHelp. It's a national resource, web-based resource, and that's really the intent of today. But importantly, to give you some background to the rationale for establishing CarerHelp, and importantly to how hopefully you can assist with regards to its uptake in the future, which would be greatly appreciated, because I am convinced hopefully it can be a resource that will lighten your load as well. Deliberately, we've allowed some time at the end for questions. So my understanding is there is a mechanism by which you can note down your questions, I think. So please think of those along the way, and there'll be an opportunity at the end to seek clarification, make comments, or ask any questions. And I think that's really important. So just to begin, I suppose, in terms of from a formal perspective, the main game here was about trying to create a resource that enabled family carers to access accurate information that was really in keeping with where they were at in terms of their role at a particular point in time. And the overarching aim was to enable family carers to be better prepared for the role of looking after somebody with advanced disease, and hopefully therefore better able to manage the role. And you'll note there that we've kind of called it the Carer's Guide to End of Life, and that was quite deliberate, and I'll come back to that in a minute. But just in terms of that wasn't the way we started off when we got some funding from the Commonwealth to create CarerHelp. In fact, our intention at the time was to develop this for family carers of people with advanced disease earlier on in the disease trajectory, but due to circumstances and the data that we were collecting, it became clear that we should focus more towards the caregivers of people looking after somebody towards the end of their life. Just to set the scene a little bit, this is a quote from a carer, and it's 15 years old now, but it still resonates with me, and I think it will with you. And I'll just let you read that. So this is a situation that unfortunately still occurs for many family carers, despite this being a 15-year-old quote, that sometimes family carers are promised all sorts of services prior to discharge of a relative, friend or partner, and sometimes what was promised doesn't necessarily eventuate in practice, and many carers feel quite isolated and somewhat unprepared, and the help that they had perhaps anticipated isn't necessarily as much as they perhaps thought at the time. And these two other reflections. I think they speak for themselves. So I've touched on, just in those quotes alone, I suppose the subtext there is some of the challenges for carers, but I do want to spend a bit of time, as I said at the start, giving you a bit of a rationale for the creation of CarerHelp. And so I've kind of labelled these challenges, but by their nature, I suppose they lend themselves nicely to reasons why we wanted to develop CarerHelp. And I'm going to go through each of these fairly swiftly, but some of this is, in fact, most of it, in fact, won't be novel to any of you, and hopefully just affirmation of information you already know. But a reminder that, you know, the WHO definition of palliative care explicitly acknowledges that healthcare services, healthcare providers should be supporting family as well as the patient or the client, treated as the unit of care. And moreover, the focus should be on improving the quality of life of family caregivers as well. And I think that's I think that's an admirable goal, but I think it's a real challenge for us as healthcare professionals to try and improve the quality of life of family caregivers as well as the person they're looking after. So I'm not saying it's unachievable, but I think it creates a challenge and a difficulty for us as we often try and ensure we have enough resources and enough time for the patient, let alone the family as well. So this creates a challenge, and a reason why we've developed CarerHelp is that hopefully by having this resource, we can move towards achieving that goal, at least part way, by giving carers an opportunity to access reliable information at a time to help prepare them for the role and hopefully help improve their quality of life by having some other information and detail in there that promotes their physical and emotional well-being. We also know through a number of reviews now about the unmet needs of family carers. So this is even sometimes in services where specialist palliative care is involved, and some of the surveys that go out and so forth, satisfaction surveys often come back with favourable results. But if you actually get family carers in a room and you ask them, thank you for your feedback about our service, and we really appreciate that. That was great. But can you identify some areas where that could be improved? Usually there's a number of things that come forward, and often this information relates to a lack of detail about how to prepare for the role of being a carer and how to manage it when you're immersed in it. And typically it's information that they want, and they want that often in biteable chunks and often reiterated repeatedly, because as you all know, carers are often quite sleep deprived, overburdened and so forth, so their capacity to retain information is often compromised. So we have this ongoing issue about the needs of family carers, and we hope that with good quality specialist palliative care, most of the needs can be met, but invariably the research is telling us that too often some of these needs aren't being met appropriately. The third area of challenges, I suppose, is the recognition that for a significant proportion of family carers, they're prone to burden and psychological distress. So what's really important here is that I don't want to pathologise caregiving as inherently damaging. It's not. If you were all family carers on this webinar, and I asked you to do a straw poll to see, on reflection in your caregiving role, could you see anything positive as a consequence of looking after your relative, partner or friend? The overwhelming majority of you would be able to say, yes, I can. We became closer through the experience, or I was able to help my husband be at home and that was his wish. So they're just a couple of examples of some of the positive aspects of being a caregiver. But the research does indicate that approximately a third of family carers are prone to psychological distress, and those data actually come from a point at which family carers enter specialist palliative care. And I'm generalising, but it's approximately a third, and there'll be variations to that, but that's a fairly troubling statistic, and it therefore creates a challenge for us to be able to try and minimise that distress, and hence another rationale for CarerHelp, again focused on hopefully giving people more accurate information to help them better prepare for and manage their role. We know, all of you know this, that there are large inequities in palliative care at the moment. So ballpark figures that say about 50% of people who should be getting specialist palliative care currently don't. So we have a large proportion of carers in Australia who are looking after somebody with a life-threatening illness, who are not receiving specialist palliative care input, or indeed support from healthcare professionals who have appropriate skills in palliative and end-of-life care. So this was a key objective of CarerHelp, to create a web-based resource that could be available nationally, and it wasn't necessarily dependent upon your postcode or whether or not you're receiving palliative care. In fact, our assumption in developing CarerHelp was that the carers who actually accessing it in the most part wouldn't actually necessarily be receiving specialist palliative care. So we preferred to work from that assumption and hope that that situation changes in the future. But that was important for us. We also know that we have this responsibility to support family caregivers, but for some disciplines, healthcare disciplines, we haven't actually had formal training in how to best prepare and support family members. So if you work in social work or psychology, for example, that wouldn't necessarily be the case. But in other areas, it's certainly not necessarily common in nursing, where there would be sort of formal tuition on how to work with and support families. Again, there would be exceptions. So we can't necessarily rely at the moment on the skill set of healthcare professionals to assess and respond to the needs of family carers, particularly those who aren't receiving specialist palliative care. So another reason for developing the resource. One of the other challenges is that there is, I mentioned before around the evidence base. I think the evidence base for supporting family carers is moving forward, but we don't have a lot of grant opportunities in this particular area. And so we saw this as a unique way in terms of trying to get Commonwealth funding to bridge that gap a little bit. So we've been doing some evaluation alongside CarerHelp to look at its utility and so forth. So this was a kind of creative way, I suppose, of developing something in an evidence-based way, where otherwise, typically at the moment, there's not a huge amount of funding available for sort of family caregiver research. We know too that many healthcare professionals complain about insufficient resources, and I touched on it before about the notion about how do you support the family along with the person who has the advanced disease, and this is difficult in a climate where resources can be limited in certain circumstances. So CarerHelp, for those of you that have had a chance to have a look, has got quite a few written resources, and also provides an opportunity to refer on where necessary to other kind of human resources that can help support family carers. We were talking about this just before we came on air, and this is point 8 about family carers not necessarily self-identifying as caregivers, and this is a real issue, and I'm sure you've all struck this, where you almost have to convince some family carers that we're there to support them as well, and their needs are worthy and legitimate. So what we've tried to do with CarerHelp is in some ways try and convince family carers that they are worthy of that support, but it is a challenge. We also know, and I touched on this a little bit earlier, about some of the difficulties of trying to support the family as well as the person living with advanced disease, and this is hard. I mean, if I asked all of you, do you come from a family where there is never any fighting or never any conflict? I think they'd be lucky if one of you were able to put up your hand. That's just the reality of families. They're complex units, and families bring with them, often decades of issues and sometimes unsettling experiences. And often in palliative care, we're in that situation where we feel obliged to try and solve a number of those issues that have been there as chronic issues for some time. And we often have, very limited time. If you think about the average length of time in a palliative care unit, inpatient unit in Australia, I think is, depending on which statistic you look at, anywhere from sort of a couple of weeks to 3 weeks. And on a home care program, we're typically talking less than 5 or 6 months or thereabouts. And again, I'm generalising, but that's not a lot of time either in home care or in inpatient unit, obviously, to try and address some of those issues. So I'm not, as a consequence of that, I'm not saying that CarerHelp does that either. It doesn't solve decades of issues, but hopefully it reinforces the fact that it's important that we try and support family carers and provide opportunities for them to reach out if they've got significant issues where they might need additional support to try and help deal with some of those complex issues, and including into bereavement. So, as I said, that this is really an overview, and I imagine for all of you, there's probably little information there that is new, but I think it's important to set the scene and to give you a good understanding of why we launched into developing CarerHelp. So the process underpinning it has been fairly comprehensive. It really was, I suppose, a four-pronged approach. So the first step was a fairly sophisticated literature review to discern the unmet needs of carers, but particularly focusing on information needs. And so that was really important, rather than just rushing in and having assumptions about what the content of CarerHelp should be. The second was the scoping study, and that looked at current carer-related resources across Australia, UK, Canada. I think they were the only countries we didn't pick US because it has a different, quite a significantly different palliative care system to Australia, whereas Canada and the UK are more like Australia. And that was really to look at those resources so we didn't duplicate some good resources already out there, web-based resources, and also to refer to those where pertinent. The third area to help inform the content and makeup of CarerHelp was our national reference group, and it's been fantastic actually to have that group together, and it's not uncommon to create such groups when developing a national project or even a state-based project. You know, you guys are all familiar with this. You establish a kind of a team of people who are key stakeholders. But I'm so pleased to say that we had such a informative group and such a diverse group, and they've been central to, I think, the success of CarerHelp right from the outset. They've been so engaged, and I think it's because they were committed to the cause. I think that the reasons that I've just articulated to you really resonated with those reference group members, and they've been with us right from the outset and are still involved actually, and they've been really core, I think, to not only the content but how we set up CarerHelp and also how we disseminate it. And then subsequent to that, so based on those three methods, we developed the draft content, and then it went out for consumer input. So we liaised directly with carers, current caregivers and bereaved caregivers, to get their insights and reflections with regards to CarerHelp, then revise the content again. So it has been a fairly comprehensive and diverse approach to creating CarerHelp, and I think that's been really, really valuable. So this just highlights the bodies that were represented on the National Reference Group, and as you can see, as I said, it's a fairly broad group, and the intent was that it wasn't kind of purely limited to palliative care groups. We wanted to reach out more broadly to other disease groups and to ensure that, you know, CarerHelp was going to be quite diverse in terms of how it was informed and created. So, as I said at the start, we ended up coming to this place of focusing on end-of-life caring, and initially, you know, as I said, we were thinking that we would focus earlier on in the disease trajectory, because I was always a proponent of not waiting towards the period of time where somebody was getting close to death to provide resources, information and care. You know, that given those stats I referred to earlier with regards to inpatient stays and home-based length of stay, I suppose my mantra has been, we need to be supporting family carers earlier on in the disease trajectory. If we look at all the data around the benefits of palliative care, in terms of from the point of diagnosis of advanced disease, it's quite clear now that there are benefits not only for patients in terms of symptom management and their quality of life, but also from our health economic dollar perspective, there are benefits, but importantly, as you all know, from a family caregiver perspective as well. So it makes sense to try and provide more information, more support earlier on. But what we realised through those sources of data collection, as I mentioned, through the literature review, through the scoping review, through the feedback from the NRG group, and importantly, feedback from caregivers themselves, was that there really didn't seem to be a lot of reliable evidence-based information that focused on the end-of-life kind of component of palliative care. And, you know, I'm thinking about palliative care, I am thinking of palliative care from the point of diagnosis of advanced disease right through to bereavement, and that the end-of-life piece is a key component, but not the only component. So this is what we heard time and time again. So the messaging was quite consistent from those data sources that we should focus on this particular point in time through to bereavement. So that was a really important recognition earlier on. And as I said, quite a shift from our initial intention where we thought we would be targeting, from the point of diagnosis of, serious illness amongst a number of different disease cohorts. So these are in terms of the way we've structured CarerHelp, we've created these 5 pathways. And so even though, as said, the focus is on end-of-life caring or caregiving, we didn't want to kind of scare people away. And in fact, that was a real concern initially, I must admit, even though we said we wanted to focus on end of life, quite a few members of the NRG and even myself was a bit reluctant to have that end of life piece so explicit. And we thought that might, scare people off. But these are assumptions, right? We weren't really sure, so we had to test the waters. But it became clear to us that it was important to also just acknowledge, as in pathway 1, the point from when somebody needs care. So we didn't want to necessarily start right from when someone's imminently dying. So in pathway 1, there's a recognition of trying to ensure that carers, even if they come into a point where their relative, friend or partner may not be imminently dying, there's still some resources for them, and they can have a look at that and say, oh, right, I'm not at pathway 4, I'm actually at pathway 1, and I'm getting this kind of core information. Oh, yes, I am a carer. This clearly notes that I am worthy, and here are some general resources that I can access. And then a recognition from carers if they're looking after somewhere where death may be a possibility. And then pathway 3, when carers actually know that dying is on the horizon, and then, or as best we can, and when person's actually dying. And this in particular was a key finding from those data collection methods I mentioned earlier. So, the real practical elements of what do I do when my partner, friend, relative is imminently dying, whether it be at home, whether it be in hospital, whether it be in a residential aged care facility. What do I do? How can I help? And what are the resources available to me? So it's very practically focused. And if you survey family carers of people who are looking after somebody with advanced disease, and you ask them, what's the most kind of important piece of information for you? What would help you most? There are usually several things, one of which is, how do I manage, provide comfort? How do I keep my relative, partner or friend pain-free? But more often than not, another key area for family care is wanting to know when the person they're looking after may be getting close to death. And that's obviously particularly important no matter what the setting of care, but it's obviously if somebody's at home alone looking after somebody in that situation, then they want to know what the signs might be. And that's no surprise to you, I'm sure. So preparing for dying and what to do when someone's imminently dying were key features of CarerHelp. And then similarly with pathway 5, which we've called after caring, which is really the bereavement piece. And again, this was an area that showed up it was clearly highlighted that there was a real gap here. So we worked closely with the Australian Centre for Grief and Bereavement around some of the content there and some of the resources. And as you all know, a lot of family members feel, very lost particularly if they've been looking after somebody for some time and lost in terms of, where to go for resources and unsure about what this experience of grief should look like, what's normal, what's abnormal. So it tries to demystify grief in a way and provide some opportunities for resources. So that's the kind of the key components in terms of the pathways, and we played around with all sorts of terms, whether they should be pathways or not. So, but that's what we settled on. And then there is this, we have what we call the carer library, which before long, this resource just grew. It just became really, really big. And one of our concerns was that we didn't want to overwhelm carers, that would just be contradictory. And I said at the start, in terms of some of the challenges for carers is, the capacity to retain information and access information due to being overburdened and sleep deprived, et cetera, et cetera. So the last thing we wanted to do was, encourage carers to go to a site and then to feel kind of bombarded with information. So as a consequence of that, we thought we'd focus on those 5 pathways, but then also support that with this carer library where there's additional resources to help carers if they want to actually attain more information in a particular area. So it's complemented too by videos from Mark Bowie is the Director of Palliative Medicine at St Vincent's, and I'm sure some of you may have heard of Mark before. He's been around in palliative care for a long time. And Regina Kendall is a nurse practitioner in Victoria. So, for example, they're talking about some of the very practical elements of death and dying, and some of the things that often aren't necessarily made public. So again, this has been quite helpful, and some of the feedback we've had has been very favourable about these kind of practical aspects of CarerHelp and these instructional kind of videos, which aren't too dense, and I think the presenters are fairly kind of natural too, I think, which helps. And these are just a couple of examples of the fact sheets, and it's actually quite hard to develop some of this information. And even this section on recognising dying, and I was looking at it yesterday, and I thought, oh, there's some other stuff we should have put there, or I'm not sure about that. It's really hard, and you often do this, even with obviously well informed, you have a group and so forth. It's that balance of having not too much information but enough without necessarily overwhelming carers. So this is not a perfect site. This is not I don't want to make that very clear. It was complex to develop, and we think there's some useful information, but it's not perfect. But hopefully it's a good start, and this can be version 1. So to complement the professional videos, we also have reflections from carers themselves. And if you look at all the research around what helps carers cope with their role of looking after somebody with advanced disease, then social support is one big component. So that feeling of not being alone, and having some, I suppose, recognition that there are other people who have been through this experience or a similar experience or are going through it currently, and that can be very helpful in bolstering carers' capacity to be resilient and to soldier on, so to speak. So these are kind of 4 very different reflections from carers that we've got on the site. We've recently too, in the COVID environment, we kind of thought, well, it'd be ridiculous to have our new CarerHelp site available but not have information around COVID. So we responded to this reasonably swiftly, and this is a bit difficult for us because obviously things are changing fairly rapidly, particularly in Victoria, where I'm from. So it has been hard to keep this up to date, but nonetheless, we thought it was even symbolic, at least, to have a section on COVID, and there's directions obviously to the standard sort of places where carers can go to get accurate, up-to-date information. Importantly, for CarerHelp, we've been able to have an ambassador or an advocate. And so this is Dame Quinton Bryce, so the former Governor General, and we're so pleased to have her on board. So she provides a 2 or 3 minute video on the site, and will be involved, I suspect, in due course again as we roll CarerHelp out more broadly. For those that don't know her, she's an absolute delight. She's a powerhouse in terms of her intellect, but also very humble. I had the good fortune of spending almost a day with her when we were kind of trying to get her on board for CarerHelp. I think it was in Brisbane, I think. And she's just delightful and so astute, and a real champion of women and also nursing. And this is not something that wasn't sort of explicitly asking her about nursing, but this is something she offered because, in fact, I didn't go in there when I was meeting with her with a nursing hat on at all, but she spoke very explicitly about the importance of supporting nursing. So she's on board with this, and I think, as I said, we hope to involve her more than just having a video piece on the website in due course. And I think that having her in the public eye promoting this will be a real advantage for the uptake of CarerHelp. This is the launch that we had at Parliament House late last year, and I'm not going to go through the people there, but it was in a fantastic event, and it was in partnership with Palliative Care Australia and Carers Australia. It's part of National Carers Week, but it was really good, and a number of the people there, or in fact nearly all of them, are on our national reference group. So it was officially launched late last year. So what next? Well, as I've alluded to, by recognising, at the outset that carers don't necessarily self-identify, our real challenge is being able to market this to carers themselves. So I think it's a lot easier through specialist palliative care providers, because I don't think it takes much to convince specialist palliative care providers that this can be a good resource that they may want to recommend to family carers that they support. But it's trying to reach those that aren't in specialist palliative care, which is our real challenge. So we've recently engaged a PR company, and there's been some ads running in the last couple of weeks about CarerHelp, and I'm so pleased that they're running, because they do explicitly talk about end-of-life care, and I'm quite pleased about this because, as I'm sure you're all aware, that palliative care is misunderstood. There's not a lot about it in the media, and it's often you hear stuff around terminal illness and end-of-life care. It's usually from funeral companies or insurance companies, advertising, and we don't necessarily do particularly well ourselves in terms of public profiling around palliative care. And I know this is just the end-of-life piece, and that's where we want to sometimes move away from, this conception that palliative care is only about end-of-life. But it's a little bit of a start, and at least it's focusing on carers. We're hoping to have a couple of other maybe TV interviews, and as I said, hoping that we can get Dame Quinton involved in something more sort of public in due course as well. But there's the PR company's also going to be responsible for some social media. There's been some preliminary evaluation, as I said at the start, in terms of the kind of research evidence-based aspect of this, and we want to enhance that even further. And we're pleased to let you know that we're actually extending the project for 3 years. So we were very fortunate to receive Commonwealth funding to create what we've called internally anyway. We haven't necessarily packaged this up as yet. We've literally just starting it off. It started in this month essentially, but we've called it Carer Diversity. So it's a 3-year extension, so that our project was 3 years and kind of officially ended last month, but now we're launching into what we're calling Carer Diversity. And the recognition here is that really CarerHelp is, whilst we're trying to reach as many carers as we can, the site is only in English. We're acknowledging that we haven't actually been able to target the hard to reach groups, such as those with poor literacy, coal community. So we need some strategies. Even in our PR campaign, we don't have the capacity to go in deep in those particular areas. So where possible, we'll modify or translate the current resources that are there into a number of different languages. And we're also looking at this concept of carers as being broader than just family members, so not just a traditional blood relative model, and so broadening it out to support workers and volunteers and community leaders. So not necessarily the kind of classic caregiver, family kind of approach, in recognition that for some people they don't necessarily have a close family in the way that we wouldn't necessarily conceive it. And then also developing a directory, and there is a large kind of key stakeholder group in this area, as you can imagine. So trying to develop something that can be used in the future as I said, I hope this, version 1 we've just developed, and this is the extension of that Carer Diversity, but hopefully down the track, this will evolve and can make sure that it's, maintained as being current. So how can you help? And I I really would appreciate it if you do get a chance to have a look at the CarerHelp website. And if you can, if you think it's, if you think it's okay, if you think it's going to be something that you believe would be helpful, and that's really important. I mean, I'm here selling it, but of course, I think it's good. I also acknowledge that it's got its flaws, but if you think that it's going to be something that you believe would be potentially valuable for your organisation, or indeed for the families that you support in your day-to-day practice, they would encourage you to let them know about it. The website's pretty easy. It's just carerhelp.com.au. There will be some more marketing that we'll do to get information out to the specialist palliative care providers across Australia. My understanding is that all services should have received something, but we're wanting to augment that in the next 6 months or so. And we've spoken about sort of even just some business cards that people could give out potentially, but yeah, if possible, if you can tell people and refer them to CarerHelp, give us some feedback and join our mailing list. So that opportunity is on the website, and we really would value that. So we prefer candid feedback. We've had lots of compliments, but we also want to hear, hang on, that section around the, terminal restlessness is inaccurate, or, that's, I don't think it's fair that you should say that, during bereavement for these reasons. How about you soften that, or what have you? That feedback's really important, because we can take that on board and adjust it wherever we can. I'm going to finish in a minute, but I just, to give you some time to question, but I just wanted to, I bring this up as because CarerHelp is just one option for you, and kind of the toolbox, I suppose, as specialist palliative care providers to support families. I think that even though I'm sort of selling this as a kind of a comprehensive guide to help family carers, it's not a panacea. It's not going to solve all carers' problems. It's one of a number of strategies that hopefully you employ in your day-to-day practice. So some carers, have been in this situation before, and well equipped. They've got very good supports around them, and they may not need very much at all. And then you've got carers at the other extreme, where they're panicking, where they really don't feel confident or competent, feel unprepared, and so forth. So just giving them the web resource is not going to be enough. They're going to need complementary information from you and from others to reinforce some of the messaging and so forth. So it's not a panacea, and hopefully you've got a number of different options available to you to support family carers. This is a quote from Abernathy colleagues from, she was actually, she's American, but she was an Australian researcher who's back in the States now. But I think it was really, for me, it resonated quite well. She published that a key measure of quality of palliative care should be the well-being of family carers in the years after relinquishing the role. And I think that should ultimately be our aim, that we try and avoid unnecessarily complicated grief and so forth in the limited time that we have. So hopefully CarerHelp can assist. I do acknowledge our partners. So whilst this was led by the Centre for Palliative Care in Melbourne, we had contracted partners through Flinders University and University of Technology. Deb Parker has been involved with our evaluation, Carers Australia, and the numerous carers are involved as well. My email is there, and also the CarerHelp at Flinders one is if you've got specific inquiries about CarerHelp, if you want to, content or otherwise, but that's also on the CarerHelp website. So please don't hesitate to get in touch with me if there's any queries about this resource, or indeed sort of family caregiver research or interventions, as it's an area that I'm fairly passionate about. But I'm going to finish there, and please, if you've got questions or comments, please don't be shy. I'm happy to take candid feedback as well. If you've got sort of immediate feedback about concerns of some areas or what have you, then happy to take that on board and take that back to the team. But thanks very much for listening, and hopefully there's a comment or a question or two.
Thanks, Peter. That was a fantastic presentation, and there's certainly been some positive feedback coming through already. There's just been a couple of questions. The first one is somebody was wondering what NRG stood for.
Oh, I'm sorry. That's the researcher in me, when you too many acronyms. So National Reference Group. So basically formed a group of a key stakeholder group who have met, I think we've probably met 10 times or something in 3 years. So basically it's nationally, usually national groups, and they send a representative, usually their CEO or otherwise, who becomes involved in the project to help us shape the content, the look of CarerHelp, and that's been a key feature of CarerHelp. So national reference group.
Fantastic. Thanks, Peter. There was also a comment from Michelle where she couldn't see on the homepage where you sign up for the newsletter or the email list. So maybe you could just help us with that so that we can do that.
Sure. I would, if you email CarerHelp at flinders.eu.au, you can CC me in on the email there. It'll go up on screen, and then we can action that. So if for some reason it should be there, but if you can't find it, that's not good. So and then we can either tell you where it is and make sure it becomes more visible, or if it's dropped off, we'll make sure it comes back up.
Fantastic. And the other comment and question that came from Claudia was that she feels that this is such an incredibly helpful resource, but she's just wondering whether you might be looking at any specific setting at all. That is, the diversity work in addition to what is available is fantastic, but she's wondering more about the specific needs for carers and their roles when the patient is, for example, in hospital. And she'd love to hear your thoughts about that.
It's a really good, they're all great questions. Always, if you feel unfair if you say that's a really good question, but you don't say that for every question, but that is a good question because it's not often asked. And I think there's an assumption that because somebody's in hospital or in a facility where there's 24-hour nursing care, that the role of being a carer is less burdensome, but that's purely an assumption. And as you all know, that's not necessarily the case. So sometimes if somebody's been looking after somebody at home, for example, when their relative, friend or partner is, admitted to hospital or hospice or wherever, to an institution, for some carers that would be, initially there may be some relief, but then for others it might be, well, hang on, I'm no longer directly involved in their care. It's a bit of a relief, but all that stuff that I was doing before is now been kind of taken over a little bit, and I'm feeling a little bit lost, and I can't be with this person all the time. And they go home and they worry if they're going to die whilst they're at home, going to do some messages or whatever. So I think to be honest with you, I think in the most part, unintentionally, this targets home-based care. I think, but we weren't explicit about that. But I think that there isn't a large focus on what to do in hospital. I think sometimes we reference hospital. We sort of say if you're an inpatient facility or what have you, but it's not. A lot of the content is not geared to hospital. Indeed, a lot of it's not geared to kind of residential aged care either. So I take that on board completely, and that's something that could be done as part of the extension, perhaps.
Fantastic. Thanks, Peter. And as you've already covered during the fantastic presentation today, I certainly found it really interesting when I had a little bit of a look around the CarerHelp website earlier, particularly with Imelda's story, and you have touched on it, that challenge of not knowing when you actually become a carer, when your role shifts from being a partner or a child or a friend into that carer role. And also that quote that you shared with us at the beginning was excellent about it's not what I expected. I really had no idea what I was in for, and I think it's really beneficial to have this resource available, and particularly as well, that people can navigate and spend some time looking at when they're comfortable doing it, and also having those downloadable sheets as well, which we as health professionals can also provide for people, because as we all know, we only retain a small amount of what we actually hear. So having it reinforced by being able to read it or sharing it with other family members or friends also gives them an understanding of what's happening and where things are heading. And I guess the one question that I had myself was whether you have any data on which of the 5 pathways is actually accessed the most, where carers kind of feel that they are looking for more information.
We do, but I don't have it to hand. In fact, we've just literally finished our report on that because we have to prepare it for the Commonwealth. But I do have that that information, I can send it to you in due course, but I don't have the results handy. But we do go to that level of detail.
Great, yeah, because I think that would be helpful for us as well as health professionals to actually have that understanding of maybe where carers are reaching out, and I guess it's possibly across a few different pathways as time progresses. But yeah, I thought that would be interesting. So yeah, we've had some really good feedback in the chat. Definitely a resource that people will recommend to their patients and their carers. And yeah, really grateful for your time today and the time that you put into the presentation, and obviously the work with building these resources as well. So thank you very much.
Oh no, thanks. As I said, I was delighted to have the opportunity, and I wish I could say I'm going to that beach behind me. It's unfortunately I'm stuck in metropolitan Melbourne, so dream on. But thank you everybody for your time and for listening. It's greatly appreciated, and good luck with the support of carers. And if we can help with anything with regard to it, please do let us know, and that feedback would be really valuable. But thanks for your time and for checking out CarerHelp.
Fantastic. Thank you to everybody that joined us today. We will also put some information in the PCNA newsletter that will be coming out later this week around CarerHelp and the resources that are available. And I just also wanted to let everybody know that there'll also be some more information about the PCNA Biennial Conference that will be in this week's newsletter as well, because it's going to be a little bit different to what we originally planned, but it will be fantastic, I have no doubt, and available to a lot of people. So yeah, thank you all again. And I hope you all have a good rest of the day wherever you are, and stay safe from this funny world we live in.